All right, good morning, everybody. This is Christian with Advantage Medical Testing. Today we're going to be talking about our new insurance paid testing procedures. This will be new for some of you, our new cycle, new times, new procedures, but I think that the end result will make everybody happy as far as getting paid. So we're just going to talk about really quickly the tests that we're still doing here and how we're going to be doing them. The insurance funded testing qualifications, requirements, overviews, the agent role now, and insurance funded testing workflow and cycle times. As of today, we're offering 4 no-cost tests: a PGX for Medicare and Medicaid, a CGX for Medicare and Medicaid, APD for Medicare and Medicaid, the Beacon Carrier test for Medicaid only. Requirements are the same. To pre-qualify, you need to be on Medicare Part B, Medicare Advantage, a PPO, or Medicare disability at any age, or Humana HMO. Medicaid is currently approved in 22 states. HMO means no, just like before, unless it's Humana. The agent roles now for insurance funded testing are different. You're no longer swabbing anybody. You essentially contact the doctors or primary care physicians and invite them to a webinar. If they want to be part of the program, because it's 100% compliant, because the primary care physician is involved in the process, which is what's required now. So you'll essentially invite the doctor to a webinar or their staff. You're involved in that webinar. If they're in, you may follow up. If not, if they're in, then we'd basically then send you the testing supplies and the equipment that's required to do the program. You'll go in and train the staff how to do the procedure and just follow up in a customer service role, replenishing testing supplies and so on. HIPAA, again, is important. The key terms are the same. The doctor now is the primary care physician. The lab is who's doing the testing, and the Ascension test is when the lab determines whether or not there's enough viable DNA to do the test. The PGX requirements are the same. The CGX requirements are the same. APD, 2 or more family members with Alzheimer's, Parkinson's, or dementia. No personal history of Alzheimer's. Beacon Carrier test. We're going to talk about, again, the qualifications for each test. Personal and family history. Nothing's changed here. Okay, PGX qualifications. They're the way they used to be. 2 or more meds in the blood, heart, pain, or psych categories. Mix and match. CGX, personal or family history, right? Personal history of a non-environmental cancer or family history of 2 or more with non-environmental cancers. There has to be at least 2 that are not gender-only specific. Again, cancers that don't qualify are going to be the skin cancers, lymphoma, lung cancers, all those environmentals. Melanoma will get somebody qualified. APD qualifications, no personal history of Alzheimer's or dementia, but they can have a Parkinson's episode. The APD qualifications for family are at least 2 members with a history of APD. In this test here, that patient will have to come up with the names and ages of diagnosis for those people. We're reviewing these qualifications not because you're ever going to ask these questions of the patient. This is to answer the questions of the staff. Beacon Carrier, females 18 to 35 who have either A, had a pregnancy, B, are pregnant, or want to get pregnant. The patient must answer yes, that they are planning on getting pregnant in the future to qualify for the test. Again, this is not for you to ask the patient. This is for you to explain to the staff, the doctor. Here's the workflow. The patient visits their doctor. The doctor has a discussion. If they find it medically necessary, in their opinion, to order these tests, then the patient will fill out on a tablet in the doctor's office all the questions and sign their consent there at the doctor's office. The nurse then will take the tablet and print out the requisition forms in the office. The doctor will sign the forms. The nurse will swab the patient, and place the samples in pre-postage paid envelopes daily and mail them to the lab. Stark Law and kickbacks. Okay, so a question is, what does the doctor get out of this deal? Well, the doctor gets the same thing he gets out of every other patient visit for every other medical test. Does not get paid anything personal for performing this test. What he does get is he gets the opportunity to bill for the consultation to actually go over those results and any treatments that result from the results of those tests. In return, you're paid for services. The cycle is still going to be 30 days because of the Ascension test. That right there, in a nutshell, is the new no-cost program.